My name is Winnie Awur. I am the East Africa Coordinator for the Tobacco Control Data Initiative, also known as TCDI, which is funded by the Bill and Melinda Gates Foundation. Kenya is one of the focus countries for this initiative.
Hello, my name is Rachel Kitonyo Divotsu, and I also work for the Tobacco Control Data Initiative Kenya project.
The purpose of the assessment was to understand the priorities, data needs, and challenges in as far as tobacco control is concerned. We have worked together with the Ministry of Health and managed to speak to a wide variety of stakeholders. This included 13 government officials, 5 civil society organizations, and 2 academics. The team has since conducted a co-design workshop to verify the data needs that were highlighted in the assessment.
According to the 2015 STEP survey, about 13.3% Kenyans use tobacco products, and approximately 8,100 Kenyans die from diseases related to tobacco use. This is estimated to cost the Kenyan economy approximately 2.1 billion every year. In recognition of all this damage from tobacco use, the government of Kenya ratified the Framework Convention on Tobacco Control in 2004 and adopted a tobacco control law in 2007. Kenya's tobacco control law is quite comprehensive, covering the major tobacco control areas such as a ban on tobacco advertising, promotion, and sponsorship, increases in tobacco taxes, a ban on smoking in public, and provision funding tobacco control activities. The government of Kenya has also made significant progress with tobacco taxation, and Kenya's tobacco taxes are currently accounting for 58% of tax of the price of the cigarette. We've also made significant progress in the area of illicit trade, with the government ratifying the illicit trade protocol in May 2020. The government of Kenya has also faced significant challenges from the tobacco industry, largely in the form of lawsuits filed challenging the tobacco control laws. And so we've had lawsuits filed all the way up to the Supreme Court, with the latest suit determined in 2020 that has finally acknowledged that Kenya's tobacco control laws are constitutional and are good for the country in terms of dealing with the tobacco control menace. During the Kenyan assessment, 8 key issues arose, which were either data priorities or gaps in the available tobacco control data. So the first was the issue of enforcement of the tobacco control laws, and all the stakeholders agreed that Kenya's tobacco control framework is quite comprehensive, but the problem is the enforcement of the laws. And some of the areas that are not enforced is the sale of single sticks to minors, the ban on smoking in public, and people felt that the reason there was lack of enforcement was lack of adequate resources being channeled towards enforcement, inadequate capacity building of enforcement officers, and just a feeling that there was general laxity in enforcement. The second issue that was identified was the issue of tobacco agriculture, and Kenya has about 35,000 farmers who grow tobacco. And the tobacco industry likes to use this as a reason to challenge tobacco control. And so the Tobacco Control Act in Kenya provides that the government of Kenya should provide alternatives for tobacco farmers. And the feeling from stakeholders was that this issue has not been given sufficient priority. And this is manifested by the lack of human resources on the ground in the form of extension officers to train farmers on how to shift. And people felt that there are also data gaps. They wanted information on what was the acreage of tobacco farming, what chemicals are being used in the farms, the economic and environmental impacts of tobacco farming in Kenya, and issues around child labor and abuses to women. The third issue that came out was the issue of cessation services for those who are addicted to tobacco smoking. Very many smokers in Kenya would like to quit, but don't know where to find these services. And so this came up both as a priority and as a data issue. There were also issues around the cost of smoking cessation medication. And so some of the latest medications are not available in Kenya, and those that are very expensive. The fourth issue that was identified was the issue of tobacco industry interference. And the tobacco industry is in Kenya in several ways. So we'd already mentioned the various lawsuits that they filed challenging the constitutionality of tobacco control provisions. They also lobby intensively with government ministries and government departments. And there have even been allegations of corruption. Industry interference, both with the adoption of policy measures and their implementation, ranked highly as a priority. The fifth issue, which was actually the #1 data gap, was the issue of morbidity and mortality arising from tobacco use in Kenya. The last survey was in 2015, and they would like more recent information on the number of Kenyans who are using the various tobacco products, but also on the disease burden that tobacco is causing. And so the linkages between tobacco and cancer and diabetes and heart disease and mental illness, because all of these are diseases that are caused by tobacco use, and how many Kenyans are dying every year from these diseases, and then what economic impact this is having on the government of Kenya and the burden upon the Kenyan health system. The final issue was the issue of safety of tobacco products in the market. And in the recent years, we've seen new and innovative products being peddled by the tobacco industry. These are products like nicotine pouches, different kinds of smokeless tobacco, and e-cigarettes. And the stakeholders did not have enough information on what were the ingredients in these products, what impacts they would have on human health. And there was a feeling that these products are not regulated adequately by the current tobacco tax regime and even the regulations providing for packaging and labeling of tobacco products.
Next steps are to continue collecting data in as far as the identified data gaps is concerned. The other next step is we will contract our research team to undertake primary data collection in as far as morbidity and mortality of tobacco use is concerned, and ultimately developing the dashboard based on the identified themes.